Good afternoon, everyone. My name is Paul Bessenbinders, and I'm going to be conducting this web seminar today with regard to the ASPA Connected Community. We've actually muted everybody's lines so that we can keep the background noise off of the call. If you have, during the course of this presentation, if you have questions, the little dialog box that you have there in your web seminar will allow you to submit questions. I've got John Brimble on the line with me who can bring those questions to me, or we can address them at the end, whichever is most appropriate. I'd also like to introduce Connie Richardson. She's on the line with us. She's the director of ASPA. And with all due to sensitivity and time, because I know it's your lunch hour, I want to get this started. So let me tell you a little bit about what's going on. The Arizona State Physicians Association is a messenger model IPA. You are all members of ASPA, I believe. And as such, ASPA brings a lot of valuable services to you, including, I think you have 23 or 24 payer contracts available to you under the ASPA model. However, there's a lot happening under payment reform and delivery reform where these new contracts that are collectively called value-based contracts or shared savings contracts or outcome-based contracts are really moving to the forefront. And for reasons beyond the scope of this call, a messenger model IPA is legally precluded from actively negotiating these new value-based contracts. But ASPA sees this as a significant part of the future of the independent provider. So ASPA has created a new legal entity called the ASPA Connected Community. It is an LLC that is owned by ASPA, but as an LLC, its charter is to work with the physicians of ASPA, work to clinically integrate physicians within ASPA so that we can collaborate in patient care, and as such we can pursue value-based contracts, whether it's shared savings or what have you. So I want to talk about that organization that's been formed and what it means to you. So the overall charter of the ASPA Connected Community, which again is a wholly owned entity of ASPA, the charter is to promote community-based collaborative care. We want physicians within our communities, within your normal referral patterns. We want you to be able to share data, electronically communicate with other practices, and have access to the maximum amount of clinical data and clinical decision support to help you improve patient care in the community. And we want to be able to pursue value-based contracts that reward us for this clinical integration work that we're doing. So, you know, there's a lot of stuff that's happening, and what we're going to try to focus on is what is it we're doing, how are we doing it, and above all, why are we doing this for you, the physicians. And of course, as part of this, many of you are probably on this call because you may have received an invoice and an information packet about the ASPA Connected Community. So we want to address the what, hows, and whys, but we also want to talk about what you can do in the ASPA Connected Community right now. So I mentioned clinical integration a couple of times already in the call. I want to take a moment. This is not an absolute legal definition. The FTC has excruciating detail about what is clinical integration from an antitrust perspective and what have you. What I want to make clear is that what I'm giving you today is ASPA Connected Community's view from a clinical perspective and from a legal perspective, but in no way, shape, or form is this meant to be a legal definition. So for us, what we're trying to do from a clinical perspective is we're trying to integrate a network of independent physicians who all are choosing voluntarily to work together with the supporting tools, programs, and processes, and having access to the right relevant data to be able to cooperate in care and ultimately improve patient care. It really is that, working together with the supporting tools and processes to improve patient care in the community. However, from a legal perspective, this clinical integration gives us a legal designation. As a clinically integrated group of physicians, we actually have the ability to then negotiate with payers as a group of independent providers to basically negotiate the terms of payer contracts financially. So the fee-for-service elements, the outcome-based and the shared savings elements, specifically based on the fact that we are able to demonstrate improvement in care and improvement in outcomes. So overall, we improve patient care, and we are able to negotiate the terms of our agreements based on improving outcomes and based on improving patient care. So primarily, strategically, what we are doing is we are bringing otherwise independent physicians together as a clinically integrated group of independent providers. And our goals are very simply, we want to give you the tools and support programs to improve care, improve outcomes, help engage our patients in their own patient care. We want to make your practice more efficient, not only within the four walls of your practice, but as you integrate and interoperate with other providers in your normal referral patterns. So let you become more efficient across the community of providers. We do want to demonstrate through our integration programs that we can reduce or manage unnecessary or duplicative services. So this is in no way, shape, or form about restricting access to patient care or eliminating necessary services. We are looking to reduce or manage unnecessary or duplicative services. And then as a result of doing all this, we want to improve our payer contracting opportunities. ASPA proper has many fee-for-service agreements available for you today. The ASPA Connected Community will have many payer contracting opportunities that reward you for shared savings, for outcomes, and for other pay-for-performance. And ultimately, by doing this as a physician-led, physician-managed approach, we believe strongly that this will help preserve your independence as a physician for the long term. So many of you have probably heard about clinical integration programs. Many of you probably heard about the most obvious example of a clinical integration program, and that is the Medicare Shared Savings Program Accountable Care Organizations, or ACOs for short. And many of you probably heard that that costs a lot of money and a lot of time and effort to put together. So what we wanted to talk about is how are we able to do this? You know, independent physicians being able to come together and do this on their own is expensive, and that's why you primarily see the majority of these clinical integration programs are being formed by hospitals, health systems, or even payers. We actually are taking the value and the scale of the network of ASPA physicians, 2,400 physicians strong, and we're basically pooling our resources and our experience already in payer contracting to basically do what it is we're doing here. So number one, the ASPA Connected Community has been established to basically put forward these value-based contracts and the competency to do it. We've actually been engaged in payer-based contracts in other forums, and it's a significant amount of effort. This is not something that's learned overnight. So ASPA and the key personnel at ASPA have that value-based contracting competency and experience, and that speaks loudly for what we're able to do for ASPA members. We've also brought together the enabling technology. So many of you have heard about health information exchanges at the state level or what have you. We are building a private health information exchange based on the leading health information exchange vendor in the country, in Medicity. So we're bringing very strong exchange technology together. We're also aggregating all of the data into a centralized data repository for use by ASPA Connected Community physicians. They say that knowledge is power. We're bringing all of that information together into a common data repository for use by our members to, number one, improve patient care, number two, to be able to do population health and actually be able to put evidence-based care treatment programs in place based on the population health, and then ultimately to negotiate better agreements. We're also working to integrate across all of the independent facilities and practices. So by participating, you'll be able to communicate and collaborate with other practices, other facilities, and we will be working to integrate to most of the third-party facilities and hospitals and health systems across Arizona. Obviously, that takes time, but that's on the agenda of what we're doing. We're also bringing clinical decision support tools, and real analytics to support the evidence-based care. Many of you have EHRs. We're not just talking about the analytics or alerts that you typically see in your EHR systems. We're talking about very sophisticated analytics tied to evidence-based care treatment programs that gives you actionable information to be able to improve patient care. We're also bringing actual real resources. So we're putting together care management and care coordination programs to help collaborate care across the community, and we're actually providing the actual RN level non-MD care management staff to do this. We're wrapping that all around with our contract administration. We're basically going to administer all these agreements on your behalf and then help you with the enabling technology to do all of this. If you look at who we've brought together, I personally work for Ideal Health IT under contract to ASPA. I am speaking to you today in an ASPA Connected Community capacity, but Medicity is the undisputed leader in health information exchange. Practice IQ has the world-class analytics, clinical decision support tools and programs to make you successful. And of course, we've got two of the key EHR vendors in eClinicalWorks and Greenway as part of this offering. So all of that's great, but why are we doing it? At the end of the day, we're doing this to improve patient care. That's the single most important reason. We believe that by pursuing this clinical integration and by collaborating with our peers in the independent physician community, we actually will improve patient care. And secondarily, the reality is healthcare reform, not the ACA Act, but delivery reform and payment reform is all around us. This is not a Medicare demonstration project. This isn't an access project. Every payer, commercial and government, is pursuing this path. They're trying to reduce fee-for-service and replace it with value-based or outcome-based payments that link payment to the providers to the actual objectives being met and the outcomes being met. So in order to do that, you can't just say, I'm going to improve care, I'm going to make things better. You need to be able to demonstrate it. So clinical integration is required to secure these contracts. Consequently, we need an integrated delivery model. We need technology to support us in doing this. We need the care management and care coordination in order to achieve the quality objectives for the community of patients. And ultimately, by doing this and aggregating that data and delivering this strategy as a group of independent providers, we can be rewarded for our work by delivering a network of physicians that is able to meet these objectives. One of the reasons there's so few IPAs doing this and so few independent physicians doing this is it takes money. And the health systems are moving quickly to lead this transformation. We are asking for some subscription fees to do this. We believe they're very nominal and manageable, and this is allowing us as a group of independent providers to do this as opposed to being bolted onto a health system or an insurer-led program. So kind of as a restatement of this, I don't want to read all of this back to you, but we're providing the clinical and the operational and the contractual mechanisms under the ASPA Connected Community LLC banner to help you meet clinical integration objectives and actually secure new payer contracts. One thing I want to note right here is we are not taking on any risk. We are not bringing any risk to you, the practice, to do this. Everything we are doing is fee-for-service plus something. We have every intention of negotiating multiple value-based contracts with Medicare, with Access, with Medicare Advantage contractors, and with true commercial payers. But in every case, we will be negotiating fee-for-service plus something. You hear a lot about risk-based programs out there. We are not taking on risk. So what can you do right now? You received an invoice. We want money. And so what does this mean for you? Well, there's three things that you can really do right now. Number one is most of you have heard about Medicare Shared Savings Programs and the catch-all phrase, the ACO. Most of the health systems in the area are forming ACOs as health system-led accountable care organizations. We are forming a physician-led, physician-managed MSSP, Medicare Shared Savings Program offering. We are submitting to be a 2014 ACO. However, to start on January 1st, 2014, we need to submit the application in July. So we are actually recruiting physicians to join a physician-led, physician-managed MSSP ACO, and by joining now, our payer contracts that we are pursuing, there are incentives in the payer contracts that will reduce the cost of the technology and the support services that we have, and we're passing that on to you. So by entering into one or more value-based contracts, it reduces your fees. So by signing up for the MSSP program now, you get access to the technology much sooner, and you get reduced subscription rates. So that's one big reason to sign up right now. The second bullet there is you will be able to access the community-based health information exchange. You'll be able to start sharing data. You'll be able to start doing electronic referrals and electronic communications, secure electronic communications with other practices. The amount and volume of health information exchange information will grow over time. What you can do within the health information exchange will grow over time, but you'll be able to start accessing that right now. And then the third thing is we are actively pursuing commercial value-based contracts, commercial shared savings contracts, commercial outcome-based contracts. We won't be able to deliver that till later in the year, till we know how big of a group we have. But right now you can sign up in anticipation of a value-based contract as an intent. So you are not being bound, but you can express your intent, and by doing that, you can actually get the reduced rates under the ASPA Connected Community subscription fees. And again, you can start to access the technology now. So what does it really take to become a member? ASPA has chosen to extend membership to every ASPA member. So by being a member of ASPA today, we are extending you membership in the ASPA Connected Community. This will give you immediate access to the technology. It'll give you the immediate ability to participate in the new payer contracts. To the extent that we start those contracts, it'll give you access to all of the clinical support, all of the evidence-based care guides, all the care management, and everything I discussed earlier to support those contracts. And for those of you who may not be ASPA members, non-members can join the ASPA Connected Community. One key requirement is that you do become an ASPA member to become a member of the ASPA Connected Community. So it's easy to join ASPA. ASPA is cost-effective. There's a lot of value to ASPA in and of itself. So the underlying principle is to become an ASPA Connected Community member, you must be an ASPA member, and you can join to do this. Another thing is for those of you who have been approached in other ACOs, in other clinical integration programs, you're being asked to participate in everything they do. We know that you need to have choice, so we will offer you a wide variety of value-based contracts, commercial, access, and Medicare over the next several years. But whether to participate is your choice, so you will always retain the right to decide to opt in or opt out of any specific payer agreement. And ultimately, the one thing I want to make sure, we've received a lot of calls since we invoiced and sent this initial information. This is a voluntary program. Your ASPA membership remains intact. Everything that you've come to know from ASPA, everything that you've enjoyed from ASPA over the years is still in place. This is above and beyond. This is a voluntary program, and by opting out of the ASPA Connected Community, should you choose to do so, that in no way affects your ASPA membership. But to be clear, if you do want to participate in these value-based contracts, and if you do want to participate and take access of the enabling technology and the support services that the ASPA Connected Community is providing, you do need to be a member of the ASPA Connected Community, and you do need to pay the subscription fees. But nothing changes your ASPA membership. So I don't want to dwell on this slide, but we wanted to talk a little bit about where we've been, what we're doing, and where we're going. So this is not new to us. This isn't something we just slapped together. ASPA has already successfully created an MSSP-based ACO in Yuma, Arizona. We started in January of this year, and we're actually running as a MSSP authorized ACO. We've also, in collaboration with Dignity Health, we have put together a clinical integration and a technology enablement program. Many of you have probably seen the EHR subsidy program through Dignity Health. That's being delivered by ASPA. So we're actually working with them in support of their ACO. To be very clear, we are not part of the Dignity Health ACO. This is an example where we are supporting our ASPA members to do whatever it is they want to do. If you want to be part of our connected community and participate in our MSSP ACO or our other value-based contracts, we're great with that. But if you want to pursue participation in one of the health system ACOs, we are supportive of that too, and this Dignity Health contract is proof of that. So what are we doing now? Well, we're starting our own shared savings contract right now for Medicare. We're taking applications to be part of the MSSP. One point of clarity, if you are a primary care physician and you are already participating in another MSSP ACO, you cannot participate in a second one. That's if you are a primary care, family practice, internal medicine, billing for primary care services, geriatrician billing for primary care services. You can only belong to one MSSP ACO at a time. Nothing precludes you from joining us and participating in the other commercial value-based contracts, though. Even if you're in somebody else's ACO, you absolutely can participate in our other value-based contracts that we're bringing to the table. And then we're also pursuing, we're in discussions with several different commercial payers right now to put at least one, maybe more, in terms of commercial value-based contracts on the table. We also, through our partnerships, are providing support for relevant practice certifications under PQRS or under medical home or what have you. And, you know, we're doing the clinical information exchange whether you're part of a value-based contract or not. And quite simply, going forward, we're looking at doing more. We're looking at focusing on a lot of commercial contracts, and actually, once we are very stable as an organization and we know that we can perform and meet objectives, we will reach out to employer groups and organizations and take on self-insured contracts as well. One point I'll note there about the integration, we are looking at, again, I said this earlier, we're looking at integrating with multiple hospitals and multiple third-party facilities as well. So when we aggregate that data into our clinical data repository, you will be able to get information from a wide variety of clinical sources. So we realize that there's two very valuable things to our ASPA members, especially since most of our ASPA members are in very small practices, and that's time, and that's funding, cost. So we realized we had to be very sensitive to this. So first of all, to address cost, we are asking a subscription fee, as most of you have seen. The subscription fee is $360 per provider per quarter, and that is only physician providers, MD, DO, DPM. We do not charge for mid-tiers, mid-levels, and physician extenders, provided they're in an MD or DO-led practice. We do have special rates for physician extenders and mid-tiers if they're in a standalone practice that is significantly lower than this, and all of that information is available on the ASPA Connected Community website that I'll talk about in a second. There's also discounts for larger practices. So some of you, some ASPA members have 20, 30, even 40 or more members, providers in their practice. There are significant discounts for larger practices. The first year includes all of our startup and training costs, so we do expect that year 2 fees and beyond will be significantly lower than $360 we're asking right now, as a lot of our startup costs are in there. Also, in addition to being lower, we are also offering, if you enter into a value-based contract, that if you normally expect shared savings at the end of the year in a value-based contract, you can pay your dues from the shared savings if you so choose. And the subscription fee, in addition to the contracts, it provides you all of the enabling technology and support. So Basically, we believe that it's money well spent, and it's money that will be well returned to you in a return on investment based on the kinds of contracts that we're able to enter into. The other thing is your time. We understand time is money, and your time is extremely valuable. We can't sit here and tell you with a clear conscience that there's going to be no investment of time, but we have put together a team within the ASPA Connected community and our partner service providers that is meant to enable your practices. We're providing clinical decision support. We're providing care management. We're providing integration to your systems so that, we give you actionable clinical intelligence with which to act on. So while there is some time working with us in order to set things up and actually facilitate that communication, we believe that with the clinical resources and the clinical decision support, we're actually going to add to your delivery capability. Under these programs, as we're trying to work together, we believe the volume of patient encounters in your practice will actually go up while we reduce overall cost across the system, bringing it down. So we believe we're going to add capacity to your practice, and that your time that you actually need to commit to the actual mechanics of reporting and integration will be very small. So at the end of the day, why is this good for your practice? The role of the independent provider in reform is really being minimized. Everyone who's large groups, large health systems are stepping in to take the reins under reform. They're exerting their control. Payers are stepping in and exerting their control. As a collaboration of independent providers by themselves don't have the capital or the time to organize, but ASPA, as a network of 2,400 physicians, we're an extremely valuable commodity. And our network, if we can harness the power of bringing our physicians together as a physician-led, physician-managed, clinically integrated group, we're extremely powerful, we're extremely valuable, and we together as a group of independent physicians can actually sustain our long-term viability and our long-term financial success. So ASPA offers you a path to pursue the value-based contracts, to participate in ACOs, to participate in shared savings programs without being bought or absorbed or controlled by a health system, a payer, or some other entity. We see it as your path to retain your independence. We see it as a path to secure new payer agreements, but ultimately we see it as a path to improve patient care. So you all received a packet. If you want to join, it's very simple. All you need to do is review and sign the 2-page participating provider agreement. You need to sign the acknowledgement form saying you want to participate in the MSSP ACO or give an intent to sign the commercial payer agreement when it comes out. And we do need it by July 20th for the MSSP. And then ultimately we just need you to start paying your subscription fees, and you are part of the ASPA Connected community. It really is that simple. Yes, there's going to be some work. Yes, we'll be there to support you to do the work, but the payoff is long-term independence, and the payoff is being able to participate in value-based clinical contracts and improve patient care. So that's really what we had to talk about. That's what those invoices you got was all about, and I will take any questions that you may have. And we have a very quiet group. I'll wait a minute to see if there's any questions that come out. Connie Richardson's on the, oh, hello.
Yeah, I was just going to mention, I've turned on the raise hand capability, so if anyone has a question, either feel free to type it in the question box, or you can also raise your hand, and we can turn the microphone on for you.
In addition, while we're waiting for any questions to come in, as I mentioned, Connie Richardson, the director, is on the call. I don't know if there's anything you'd like to add, Connie, but I'm giving you a little bit of a pulpit if you'd like.
Well, I just want to thank everybody for being on the line and hope that they, seriously consider what we're doing here. This is an opportunity that I feel is very important for our physicians. I've always been a very strong advocate for the independent physician and think that this is the one avenue that we have to express a voice and take control where control should be, and that is within the physician community. I hope everyone seriously considers it. If you have any questions that you want to talk to me about directly, you can either email me or call me, and I'll be more than happy to talk to anyone. Thank you.
So as we're waiting just a moment more, as you see at the bottom of this page, the ASPAConnectedCommunity.com website is live. There's a lot of good information out there specific to the different value-based contracts, specific to the enabling technology that you have. I encourage you to go out and look at that. We have recorded previous webinars. Those are available. And we will also be posting over the coming weeks little snippets around specific areas, a little bit more about what the MSSP is, a little bit more about what commercial shared savings is, a little bit more about what clinical integration is. So check back as there will be new content, but as it is right now, there's a lot of good information out there for you. So with that in mind, I don't think we're having any questions. So I would like to thank everyone for your time. I know you're very busy, and I appreciate your taking the time. Please feel free to call Connie or myself, or call us at the 855 number there that you see at the bottom of the page, and we'll make sure that if we don't get to you directly on the call, we'll follow up with you immediately. Okay? Thank you very much.